Hi, this is Matt Leshner again. I'm doing another video about borderline personality disorder, but this one is actually more for providers, like primary care providers, dentists, podiatrists, endocrinologists, anybody who interacts with people that have borderline personality disorder but is not a psychiatrist or a psychiatric nurse practitioner or PA. The first thing I want to tell you is this. When you see borderline personality on a chart, don't always believe it. Borderline personality is way overdiagnosed. In fact, I sometimes think that some providers just diagnose people that they find annoying as borderline because they're not interested in digging deeper to find out what's actually going on with them. Not that borderline people are annoying, but I think anybody who's does this as their main gig, works with borderline people regularly, does know that it's going to be there's going to have ups and downs. So the first thing I want to tell providers is this: when you see borderline personality on a chart, stop sighing and ho-humming and all that fucking bullshit. One, you do not know if this is a good diagnosis. You do not know if this is an accurate diagnosis. Why? Because it's hard to diagnose. It's not easy. It's not, personality disorders in general are a lot harder to diagnose than what we used to refer to as Axis 1, things like depression, schizophrenia, anxiety. Next thing is this. Not all borderlines are the same, right? So, some folks with borderline personality will have that explosiveness, but some people have kind of an inversion of explosiveness, which is intense people-pleasing, which is not awesome for them. I'm sure some, providers, especially those who like to steamroll their patients, would appreciate a little bit more compliance or reverence or whatever, but the reality is it's not actually super helpful to your treatment of them or of their experience. Next thing I want to say is do not sort of assume that things are going to start off on the wrong foot. Don't assume that things are going to be argumentative. I really honestly believe this, that a lot of my borderline people, because they tell me about this stuff, I went to PCP and I had this big blowout fight over this and this. I do think that a big part of that is providers are seeing borderline personality on a chart and they're saying to themselves, this is going to be really bad, and so they're steeling themselves for this fight or whatever they expect is going to happen. And when they get there, it's a self-fulfilling prophecy. Now, do some patients start fights? Sure, it happens to me too. But do providers need to do a much better job with borderline personality? Yeah, we really do.